5 things to remember about edema disease. Edema disease is caused by Escherichia coli, but another strain than the one that causes neonatal diarrhea. It's an F18 E. coli that produces sugar toxins. It is pretty different from other strains of Escherichia coli because the colonization is pretty long, up to 5 days, sometimes even 6 days, for this E. coli to colonize the entire small intestine of a pig. Contrary to neonatal colibacillosis, the affected pigs are older than 20 days of age. That means that at that time they're usually in the nursery. The reason why is because before 20 days of age, they do not have the receptors on which that F18 E. coli can attach in the jejunum. Clinical presentation is central nervous system signs, usually meningitis-like signs, where pigs are on their side, they're paddling, they cannot stand up by themselves, or they have that drunken walk. Sudden death is also very common and usually affects the biggest, nicest pigs in the pen. Pretty characteristic are the edema of the eyelids, the forehead, and sometimes even the larynx, which makes the pigs have this really high-pitched scream, very different from the usual one. But remember, F18 E. coli does not cause diarrhea in pigs, contrary to neonatal colibacillosis. The diagnosis is made by culture and isolation on intestinal tissue. We do not do culture and isolation on brain tissue because remember that F18 E. coli is toxigenic. It's a toxin that is absorbed in the gut and then go to the brain through the blood circulation and then causes damages in the blood vessels of the brain. Therefore, the bacteria does not leave the gut. That is very important to remember. The prognosis of the pigs that have meningitis is very poor. However, remember that the colonization of the gut by the bacteria is long, so it's very likely that other pigs in the pen or even in the barn are already infected. Therefore, we need to do antibiotic treatment for the entire herd. Cleaning and disinfection to eliminate the pathogen from the environment is also critical. Herds that are affected with F18 E. coli usually get reinfected recurrently. It's important to break that cycle by using good disinfectant protocol.